Welcome to the Sheer Recovery Podcast, brought to you by the BeWell Network. My name is Dr. Ted Bender, clinical psychologist and addiction specialist. I've spent my career both as a suicide researcher and addictionologist. You can always learn more about us at the SheerRecoveryPodcast.com or BeWellNetwork.com. And if you or a loved one are struggling with mental health or addiction needs, please call us at 1-888-979-7703. Today we are here to talk about suicide. Suicide is the 10th leading cause of death in the United States and the second leading cause of deaths in teens. Today our guest is renowned champion boxer and mental health advocate Mia St. John. Today Mia is going to speak with us about mental health awareness and suicidality. Mia, thank you so much for joining us.
Thank you for having me.
So Mia, I know you're an advocate for suicide awareness.
Right.
Before we get into the depths about this very serious topic, would you mind letting our audience know a little bit about your background and kind of what led you into this work?
Yeah, I started actually fighting when I was 6 years old. And by the time I was in my 20s, I decided I wanted to turn pro. But my mother, being from Mexico, and, brought us to the United States. And, it was a very difficult time. And, because it was late 60s, early 70s. And my mom said, I didn't bring you all the way to the United States for you to be a boxer. But she knew it was something that I really wanted. So she told me, okay, if you get a degree in college, I'll let you turn pro. And so I chose psychology because I just wanted to understand, why I was the way I was. Mm-hmm. And get a greater understanding for that. And so I got my degree in psychology, and that's really what started it. So I was really always interested in mental health.
Got you. And what made you decide to go full force into mental health awareness and into the work that you're currently doing today?
Well, what started that was I had a son who had schizophrenia, and that was my worst nightmare, was because I knew about schizophrenia from studying about it, and I knew that it was degenerative and it was an illness that they had no cure for. So I was devastated, but we did everything that we could. We had him in and out of doctors, in and out of mental health facilities, and because he also became an addict, he was addicted to meth. We had him in and out of rehabs. And I was doing everything I could in the mental health system. I partnered with Congresswoman Napolitano, and Meta World Peace to advocate for mental health. And then my son actually took his life in one of the rehabs that we had him in. And that even pushed me even further into that world.
Can you tell us a little bit about your son?
Oh, my son was, oh my God, he was the love of my life. He was an artist. He had a lot of his artwork at the Laguna Gallery of Contemporary Art, and was just, he was eccentric. He was creative. He was just the most beautiful, kind soul.
Thank you for sharing that. I appreciate it.
Thank you.
Can you tell our audience who may not be so familiar with schizophrenia, what is schizophrenia? What kind of symptoms go along with that? And what did you notice in your son, especially early on? What were some of the earlier symptoms?
Well, the earlier symptoms were he was reclusive. Mm-hmm. He didn't talk much. And, those are things that are kind of normal, mm-hmm. right, in the teenage years. Yes. You see a lot of that. He was very depressed, and that could also just be, the teen years. So it's very hard to diagnose at such a young age. Mm-hmm. So we really knew that something was wrong when he started hearing voices, mm-hmm. but he didn't admit it at first. But we could hear him in his room talking to someone, mm-hmm. knowing that no one was there. And so by the time he was 18, he was finally diagnosed with schizophrenia.
And for our listeners out there, schizophrenia is a very serious mental health disorder that is characterized by hallucinations, both visual and auditory, often in a very derogatory term towards the person who is suffering from them. Often these voices are telling the person suffering from schizophrenia that they're worthless, or that they should take their own life, and a host of other extreme difficulties. And like you mentioned, and especially when it occurs in early teens, it can be very difficult to parse apart, is this normal teenage behavior,
Right.
or is this the beginning of something more severe? There's a lot of myths around suicide and a lot of misunderstanding about suicide. Given your experience with this, with close personal family members, what are some of the myths that people have brought to your attention or you've encountered over the years that you'd like to address?
Oh, gosh. Well, the biggest one that I've heard is that the person who takes their life is selfish,
Yeah.
not thinking of others. And what they don't understand, especially when someone has schizophrenia, like you said, these voices are commanding you to take your own life, telling you you're worthless, and which was the case with my son.
Yeah.
And it would drive me mad if I had all these voices
Yes.
in my head. And I equate it to, because I've been suicidal since my son passed. I'm no longer suicidal, but there was a time that I was. And I describe it to people like it feels like you're on fire and you're going crazy. You don't know what to do, and you just want to jump in the water
Yeah.
to get the fire off, right? And so that's how it feels, like you just want to stop it any way that you can.
I'm really glad you brought that up, because you're right. A lot of people think that it is selfish or, quote, the easy way out. But if
Right.
you think about it, the most fundamental drive of all human nature is survival.
Right.
Overcoming that survival instinct, there is nothing easy about that.
Right.
And when it comes to someone who is suffering from suicidality, they are convinced that they are a burden on their family members, and then that everybody would be better off if they were gone.
Right.
But none of that is true.
Right.
These are known as cognitive or thought distortions that riddle and plague many different kinds of mental health disorders. So I'm really glad that you brought that one up,
Yeah.
because it's important for our listeners to understand.
And I think that also, like when you're suffering from, when you have a dual diagnosis and you're suffering with something like addiction, that just adds on to it. And I know for myself, being an alcoholic, many times I've felt suicidal under the influence, right?
Yeah.
And so when someone is doing drugs or alcohol, that just intensifies the suicide ideation, you know. So it's very difficult. It's a very difficult thing.
Are there any other myths that you've come across or people have brought to your attention or asked you questions about in the last few years?
Well, I think the main one is what you said, that people think it's the easy way out, and it's really not. It's something that they often contemplate for a long time.
Yes.
I know that my son thought about it for a long time, and it wasn't his first attempt. You know, we were able to save him in his previous attempts, but this was the one time that we were not able to.
That brings up yet another very important myth, and this is one that a lot of people think, that suicide is very impulsive, meaning that someone goes from not thinking about suicide, not having a plan, to all of a sudden very suicidal. And the research does not support that. What you just said about the, contemplating for long periods of time and having a plan over long periods of time, that is much more likely to be the case rather than some immediate or impulsive act.
Yeah, and many of them, it's not their first attempt.
Right.
And, the other thing that just drives me nuts is when people say that, oh, they're just doing it for attention.
Yeah.
And even if they are, what does that say? a cry for help. Someone wants help. Is that so bad? If they are doing it for attention, is that really bad that they're crying out for help? Shouldn't they cry out for help? So, yeah, I never really understood that.
Exactly. And, I always tell family members and people that I've come across in treatment that even if they say it a lot, like you said, don't become habituated to that and not take it seriously because it is a cry for help.
Right.
Whether they say it once or twice or they're saying it all the time, there is something wrong.
Yeah, exactly. And that should be taken seriously rather than like, he just wants attention.
Do you think asking about suicide makes people more suicidal?
That is a myth.
Right.
That if you talk about it, they're not going to think about it, which is, in my opinion, that's absolutely false.
Yes.
Because I believe that it should be talked about because it's real. That's like saying I'm not going to talk about sex to my kids because if I put it in their minds, then that means they're going to go have sex. No, it just means they're going to become educated about it. And there's nothing wrong with educating our kids about mental illness, sex, drugs.
Yeah, I couldn't agree with you more. And the research also agrees with you. Not only is asking people about suicide not iatrogenic or detrimental, it has actually been shown to have a positive effect for someone who's suffering from suicide. So to our listeners out there, if you get the feeling that someone may be suicidal or a friend or a loved one is struggling with thoughts of self-harm, the best thing you can do is to talk about it with them, to reach out to them and be there to support them, and even better, help them get to the resources that they need to prevent an attempt or death by suicide.
Right. Just to mention, I love when my therapist or my doctor asks me if I have any thoughts of suicide because I want to talk about it.
Yeah.
I want to get it out there, and I want help. I want someone to help me. So I actually, just being on the other end of it, I love it when I'm asked about it.
Does it make you feel more validated?
Yes, like someone acknowledging that my feelings are real and that I do need help, and someone trying to find a way. I have a very good psychiatrist who is always asking me that and always trying to get behind like the feelings of that and what can we do. And I feel that now like I'm on the best meds I can be on, the best medication that I can possibly be on because of her constantly asking and trying to find a solution.
In the treatment process, the assessment piece is never really over because you might need to make adjustments or make adjustments to medication based on what's going on now versus when you started a year ago. And the consistent assessment around what you're dealing with today is important in that therapeutic relationship.
Yeah, I agree. My doctor is always, I've changed meds like quite a few times, but medication is a tricky process because it is trial and error.
Yes.
There's no one set medication for this illness, and it's all, and my doctor goes off of symptoms. She doesn't diagnose me with anything. She just says, I'm going to treat your symptoms. And the interesting thing is I've gone through so many meds, but I'm actually now on 2 meds that are usually for people with schizophrenia. And I said to her, oh no, like, do you think I have schizophrenia? And she said, no. She said, this is just to treat your symptoms.
Yes.
And I love that. I don't like the labels.
Yeah. So you found what works for you.
I found what works for me, and even though it's not generally like, because I suffer from generalized anxiety disorder and panic disorder, and so it's not a med that's typically prescribed, but she was just, trial and error, and it just happened to stick. Like I said, this is the one, this is the med, like I finally found it.
So Mia, you have a book coming out in December, Fighting for My Life, a memoir about a mother's loss and grief. What inspired you to write that book?
Well, actually, this came about during the pandemic, and I had relapsed again. And my agent called me and said, hey, why don't you write another book? And because I was still dealing with the death of my son's father and the death of my son, and he thought it was the perfect time to get, the message out there. And I felt like it was perfect timing because there were so many people suffering at the time, and there were the suicide rate increased and the addiction rate, and I really wanted to talk about all that and help other mothers and other families that were going through what I was going through. So that's how the book came about.
And thank you for writing this. I'm looking forward to reading it. It really makes me think about parents who have lost a child to suicide, and it can be really common for them to start having their own thoughts about suicidality and deep depression. What advice or thoughts can you give to parents out there who are struggling with the death of a child?
Well, I'm glad you brought that up because my ex-husband dealt with the grief in a different way that I did. Mm-hmm. I didn't see his grief because he was still working, on Young and the Restless, and so he had to go tape every day, and he had to put on a smile and pretend like everything was okay. So I always felt like I was suffering far more. I went into a deep depression. I became suicidal. I relapsed. And so what I realized was just that I was verbalizing it and people could see it. Yeah. Whereas he was keeping it all inside until he finally couldn't take it anymore, and he ended up drinking himself to death. And that's when I really realized, like, wow, he was suffering so much. And the advice that I can give to other mothers is that, it's a journey through this process, and you're going to have ups and downs. And for me, as a mother, there is no recovery in the loss of my son. I will never recover. But what I can do is accept what's happened and try and move forward. I'm going to grieve my son every day of my life for the rest of my life. But we can still move forward. I don't think I'll ever get to the point where I say I'm recovered. Right. I can't recover from the loss of my son. It's just impossible. But like I said, we can find ways to cope and continue moving forward.
And for you, being an advocate for mental health awareness and even what you're doing right now, has that helped you in that process?
Oh, yeah. Because there's so much support that I've had. And, there's a lot of things that I do during my day that keep me going. Like I said, keep me moving forward. I meditate every day. I try to refrain from alcohol and any other mind-altering substances because, again, that really brings me down. Alcohol is a depressant, so we know that. So I try to refrain from that. I still work out every single day. Yeah. I do yoga. I'm around nature a lot, and that really helps. And I try to remember my son in the good times that we had, instead of going over, the last part of his life and the hard times that he had. I try to remember all that was good about my son, and that's how I keep moving forward.
You mentioned your son and your son's father. Is suicidality genetic? Can it be passed along?
That's a very good question, and I don't know the answer to that. I know that my ex-husband, his parents did suffer from depression, and I don't know whether they ever had thoughts of suicide, but I know that depression ran in the family, and my ex-husband was diagnosed with bipolar.
Gotcha.
So I do think that that's hereditary.
Yeah.
I don't know about suicide ideation.
So
though.
he had some mental health history in his family, and,
Yeah.
and you had some addiction history in your family as well.
Oh, yeah.
As a clinical psychologist and suicide researcher, there is pretty significant research out there on a strong genetic link and heritability effect of suicidality. And we often see, like you mentioned, long histories of mental health within the family and or co-occurring addictions. Also, we typically tend to see, like you mentioned, anxiety disorders such as post-traumatic stress disorder. Oftentimes in working with veterans, in 2010, 2011, we would see soldiers coming back from Iraq and Afghanistan, and I was treating post-traumatic stress and trauma-related disorders, but almost always there was a co-occurring addiction. And we did lose, and we still continue to lose a lot of our veterans to suicide, and we see a lot of familial history with that as well. You mentioned, I thought that was interesting too, your training as an athlete has helped to continue to keep structure in your life, and you mentioned that's been helpful in helping keep you sober and keep you on a forward path. Could you talk a little bit more about that?
Yeah, well, I think that just being a fighter, you know, we have a certain mentality.
Yeah.
You know, if you think about it, like, you know, we go into the ring with the sole goal to render another human being unconscious at all cost, even if it means our own life. And as morbid as that sounds, like that, you know, I mean, that was my profession for, you know, almost 3 decades. But I think that the mentality that I'm going to survive no matter what has played a role in keeping me here after the death of my son, because I remind myself of that. Like, I am a fighter and I am never going to give up. Never.
I think that kind of leads me into another question, really, which is, you know, what advice would you tell kids or teens that are listening right now if they're experiencing thoughts of wanting to harm themselves or hurt themselves?
To talk about it.
Yeah.
Talk about it. Tell someone, because there is help out there. Yes, it can be difficult, you know, not knowing who to turn to, where to turn, what to do. And like I said, medications are like just trial and error, you know. So it's a difficult process, but I would say talk about it, tell someone.
I would agree with you completely. And working in the field of mental health, medications can be a bit of a trial and error. There are a lot of good medications out there to treat depression and anxiety, but what medication may work well for you may not work well for me. And unfortunately, the state of the science is that we have to do a little bit of experimenting and adjusting.
Right.
And as far as children or teens out there that are listening, or really anyone experiencing or suffering from these types of thoughts, your mind is going to tell you that there's no way out. Your mind is going to tell you that everybody else will be better off if you're gone. Your mind is going to tell you that you're a burden on others. But your mind and your thoughts are not always accurate. And just because you have a thought does not mean it is gospel truth. And we need to challenge those thoughts. And that's where really reaching out for help and telling someone how you're feeling can be helpful.
And I'd like to mention that for anyone out there that has schizophrenia, or that are, because a lot of kids don't know what schizophrenia is, but if you're hearing voices, it's okay to tell someone. It's nothing to be ashamed about. I mean, if you look at like artists throughout time, you know, like Van Gogh or, you know, Basquiat, you know, a lot of artists and musicians and actors, because it can hit anyone. It doesn't matter what, you know, field you're in. And so you can still be very successful, you know, with schizophrenia. You still, life is not over, you know, as we first think about it when we first hear the word schizophrenia.
Yes.
Life is not over, and you can be very productive and very successful. And so if you're hearing voices or seeing things, there is nothing to be ashamed about. It's okay to tell someone. But if it's bothersome, you shouldn't have to live with it. If we have a medication out there that can help, then I think that we should be pro-medication. And I know that there's a stigma with medication.
There
a lot
is.
of people are anti-medication, or I'm never going to take meds, or you're crazy if you take meds.
There is a tremendous stigma around these things. You know, if there's anything that good that came from the pandemic at all, I think that we did make a little bit of progress on reducing the stigma around mental health, because the pandemic has brought about a significant increase in people suffering from depression, anxiety, and trauma-related disorders. Some estimates as high as 30% of the country is now suffering from one of these diagnosable illnesses. It's not just in the shadows anymore. It's a third of Americans. And it is becoming more acceptable, although we have a long way to go,
Yes.
to get treatment.
Yes.
You mentioned schizophrenia, and it is not an easy mental health disorder by any means, but it can be managed. It's going to be a struggle, and it is difficult. But I always try to explain to people that these are like medical conditions. If you have diabetes, for example, again, it's going to be difficult to manage, but it can be managed.
Right.
It's not always going to be easy. There's going to be setbacks. But we have to equate these kind of mental health disorders just the same way as we talk about medical disorders.
Right.
If you have type 1 or type 2 diabetes, no one's going to question you for taking insulin and taking care of yourself.
Right.
But when it comes to mental health, that stigma remains, and people think of it as something different, when it's really just as important to treat and manage that as any other medical illness.
Right. And I think it's important to note that there are good things that can come about with these disorders,
Yeah.
right? Like, for example, my OCD, my anxiety disorder, is what helped me become a 5-time world champion,
Yeah.
because I was obsessed and nothing was going to get in my way. And I had this routine that I did every single day, and that was my training. And if I didn't have so much anxiety and obsessive compulsiveness, I don't think I could have become the world champion that I did. And with my son's case, he was an amazing artist. You know, that he had galleries all over Laguna, and the media would come out and interview him and photograph him, and he was on TV shows. And so that was because he was so creative, and a lot of his delusions or hallucinations were part of his art.
Yeah.
And his art was so amazing. And so that was the good part about it.
You know, kind of getting back to the myths around suicide again, one I hear quite often is that if someone really wants to die by suicide, you can't stop them. Would you agree to that? Would you agree with that?
No. I believe that, you know, it's a tough thing because, you know, my son, like I said, he tried many times before he finally succeeded. And, you know, we did everything we could possibly do, but I still believe that there was hope.
Yeah.
I will never, ever say that there was no hope for my son. I still believe there was hope.
Yeah. And I agree with you. There is a lot of research around means restriction. So over half of completed suicides in the United States are with handguns. I think it's 52% or something like that. And research is very clear that if you remove handguns from the home, you reduce overall risk of suicidality. So means restriction is an effective measure and method of preventing suicide. Nothing's 100% guaranteed. But chronic lifelong suicidality is another one of those myths. You know, a lot of people believe once you become suicidal, that's how you are for the rest of your life. Was that your experience?
No, because like I said, I was suicidal after the death of my son.
Yeah.
And when I had relapsed. And no, to think that I had no hope. No, I always held out hope.
Yeah.
Always held out hope that one day I could live and be okay with that. But at first, the idea of living out without my son, it was unfathomable.
Yeah.
I couldn't even fathom that, but I did. And I'm here today.
Mm-hmm.
So, no, I don't believe that.
So for you, it was more transient in nature, meaning it kind of came and went at times, where you'd have these thoughts, or these thoughts would escalate, but at other times they weren't as strong or as prevalent. Is that accurate?
Right. And something important to note is that I did get help. My boyfriend actually had me 5150'd twice because I was suicidal. And I was so mad at him. I remember being in the facility, sending out texts, someone help me, get me out of here. I was even on Twitter saying, get me out of here. I'm being held captive. But I look back on what he did, and now today I thank him.
Yeah.
And I say thank you for getting me out. Because it's a hard thing to call a 5150 on someone.
Can you tell our listeners what a 5150 is?
So it's being held against your will. It's when someone is a threat to themselves or to do harm to themselves or to someone else. And in this case, it was to do harm to myself.
And you mentioned that ended up being one of the best things for you. Why is that?
Because I realized, once I got out and I got the help I needed and the proper medication, that I look back and go, oh, thank God I didn't die.
Yeah.
It's how I felt at the time. But remember, a lot of people they come out of it.
Yeah.
They don't always feel that way. And that was just a dark period in my life that, yes, I was suicidal. But thank God it wasn't completed.
Yeah.
And someone reached out to get me help. But it was a very tough thing for him to do.
I'm sure.
Because he knew that I would be so mad at him. And I went kicking and screaming, and he did not care. And it was hard. I watched him cry as they took me out.
Yeah.
Because no one wants to do that.
Exactly. And sometimes it's that reset that really is a life-changing moment for some people. We hear stories like this with mental health, also with addiction. I've had many family members tell me that they had to put that limit down and say, listen, you're not coming back to my house while you're using, you have to get help, or that's it, we're cutting you off. And in the moment, like you mentioned, kicking and screaming, but a few years later with some continued sobriety, they look back at that as being a pivotal moment for them.
All right. Well, I don't believe, I have to say there's one thing I disagree with. And I know that a lot of the programs such as AA will say, you have to cut someone off if they don't stop what they're doing. And we've seen it on the show Intervention. The families come, they intervene and say, we're going to cut you off if you don't go get treatment. I don't believe in that. I didn't do that with my son, and I just don't believe that we should ever give up on our loved ones. I mean, it doesn't mean we have to take them in when they're using or enable them, but I just don't believe in cutting them off.
Yeah, there's the fine line, right? It's not about giving up on them, so to speak, but the enabling piece, it's a difficult balance.
It is difficult.
Yeah,
it's
sure.
really difficult.
One thing that frustrates me as a suicide researcher and working in the mental health field is we know more now about suicide. There's so much research behind it. We know more than ever, yet the rates are higher than ever. What do you think we need to do as a society to finally try to reverse this trend? What can we do?
Talk about it. And really talk about it. I saw a commercial the other day, which is just so angered me. It was for a medication for schizophrenia.
Yeah.
And it showed all these people with schizophrenia talking about their life seemed so normal, but they got a little depressed. And so they went on this medication. And I think that I get it. They don't want to show the worst of these illnesses. But sometimes we have to see that. We have to see what a person who is really severely depressed looks like. What someone with schizophrenia. Look at all the homeless that we have in LA County.
Yes.
Walking the streets, talking to themselves, doing drugs. And, well, now that's a good example of people that are suffering from mental illness.
Yep.
But we don't want to see that in our society. We don't want to see that.
And there's a very high rate of schizophrenia in the homeless population.
Yeah, and a lot of them are self-medicating, like my son did.
Yes.
Because with my son, in his case, schizophrenia came first. Then the drugs came in after that.
As is often the case with severe addictions, a lot of times, and really most of the time these days, we see the drug use or the substance use or the alcohol use as a way to cope with extremely difficult symptoms, whether that's from severe illness like schizophrenia or severe anxiety disorders, trauma especially, depression. And these days, that's more the norm than the exception.
Right. And I know that for me, when I relapsed, I was self-medicating. And I believe now, like, looking back, like, or even now, I have PTSD because the moment I got the call from the facility to tell me that my son passed, it's all like so surreal to me because I just remember I was driving and I was just screaming and crying. I don't even know how I got home, but it was about 4:45 in the afternoon. And ever since that day, that's when my panic attacks would start.
Around the same time.
Around the same time. And I didn't make the correlation until years later. And I just brought it up to my psychiatrist like a month ago, and I said, you know what? I've been going over my panic attacks, and it just so happens that it happens every single day at that exact time, about 4:45.
The clock was a trigger.
Yes, and that's when I would start my drinking. And I told her, I think I'm self-medicating. And she says, you think?
You know, we've talked a lot about what people should do if they're struggling and, you know, reaching out for help. But one of the things that I find most difficult for people is to help them reach out to people they think might be struggling. Because someone who is suffering from depression, you can be sitting in a room next to them and never have a clue what they're going through. People can hide it really well. So you mentioned the time on the clock being a trigger for you, which led you to have panic attacks.
Yeah. And that led me to drinking at that. I always said I'm a happy hour drinker, but that was why, because it happened at 4:45.
Yeah, and then the drinking became a way to alleviate the symptoms of panic and anxiety around that same time.
Exactly.
And that's a very common thing to experience with post-traumatic stress disorder. Again, working with veterans that were coming back from Iraq and Afghanistan, they would describe to me all kinds of triggers that would lead them to have panic attacks or severe anxiety reactions and feelings of depersonalization or, you know, feelings of almost watching their life from above.
Yes, exactly.
And they would say things like cars backfiring, like the muffler, or helicopters flying overhead, or the smell of gasoline, because, you know, in Iraq there was a lot of burning oil fields. And that can be extremely debilitating. Luckily, there is really good treatment out there for post-traumatic stress disorder. When you're experiencing PTSD, it can often feel like you're the only one or that you're going crazy. Did it ever feel like that for you?
Oh, yeah. Yeah, it was traumatizing, and I didn't, like I said, I didn't make the correlation until years down the road.
And for our listeners or people out there that may have been experiencing similar things in relation to some sort of trauma, there is excellent treatment available. Cognitive processing therapy is an excellent way to treat post-traumatic stress disorder, as well as exposure-based therapies. Oftentimes people struggle with these type of treatment, or especially early, because they're scared of it. Let's face it, anxiety is the fear of fear itself. But if you can make it through those first couple sessions and really commit yourself, there is a way out, and you don't have to live the rest of your life suffering from these disorders. Could you tell us a little bit more about your charity, and also when is your book coming out?
Yeah, thank you. Well, the book Fighting for My Life comes out in December in stores everywhere. And right now you can actually get it on Amazon on a pre-order.
It's available now.
It's available now for pre-order,
Great.
but it actually comes out in December. So, and for more information on my charity, I have a foundation for young adults who are suffering from mental illness and addiction, and that's miastjohnfoundation.org. And you can make a donation there, or you can read about all of our programs, and you can email me there as well.
Great. For our listeners out there are many resources for those who are struggling. If you're having thoughts about self-harm or wanting to harm yourself, the Suicide Prevention Lifeline is 1-800-273-TALK. That's TALK. We are always here to help at the BeWellNetwork.com. And to those who are listening, remember this. More than half of all suicide completions in the United States are handgun related. If you're a gun owner, please make sure that you are locking up your weapons responsibly so people cannot access them. If you're having thoughts of suicide or harming yourself, ask a family member to remove the guns from the home. And another thing that not a lot of people think about is your opioid-based or narcotic medications that may be sitting collecting dust in a medicine cabinet. People don't think of that as usually being very dangerous. But in my experience, those can be just as deadly as a handgun left loaded on a kitchen counter. So please take the time to lock those up and secure those responsibly as well. Thank you so much today for tuning into the Sheer Recovery Podcast, brought to you by the BeWell Network. I'm Dr. Ted Bender, and I'd like to thank our guest, Mia St. John, for helping to bring awareness to this incredibly important topic.
Thank you so much for having me. And for anyone out there that wants more information on my charity, you can go to miastjohnfoundation.org.